So if your brain's a CEO and you have control over your brain, then that means that you should be able to just fix this in an instant. But I don't think that's necessarily true.
Right.
That's
the conscious mind.
Right.
And then you got a fun thing called the subconscious.
Right.
Which is all the experiences ever in your life
Right.
that you've ever had. And that really runs the show.
Hello everyone, welcome to the Movement and Performance Podcast, where it is my goal to help people get active, connect with their body, and perform better. Today I have with me Dr. John Guerriero, and we'll be unpacking the complexity of pain. Without further ado, let's get right into it. Thanks for being on the show, brother.
Thank you for having me.
So getting into the content a bit, before we talk about pain, just how would you even define it? Just to get that consensus.
The way I explain it to my patients is pain is the body's alarm system. It's just there to let you know something is wrong, right? So it makes you pay attention. It's the brain saying, hey, pay attention to this. This might not be good, right? There's good pains, there's bad pains. The definition we use the biopsychosocial model of pain, which is the most common model used today rather than biomechanical. Biomechanical is a bit reductionist. The Cartesian way of describing it. Now we use a biopsychosocial model, which is much more inclusive and is how pain actually works. So that definition is pain is a multi-system output activated by the brain based on a perceived threat.
A perceived threat.
Perceived threat.
It's funny, when someone starts talking, I end up thinking of 1,000 questions I want to ask.
Yeah.
The first one was, you mentioned it seems as if pain can have some value in a good way.
Oh, yes.
Right? Because you said good pain and bad pain.
Correct.
Where does that line get crossed between good and bad?
We exercise.
Right.
You feel muscle burn?
Right.
Is that painful?
Yeah.
Yeah. So we would describe that as good pain. So before you start exercising, are you like, I can't wait to feel that? Right? So that would be a good pain. If you're getting a really great massage and the knot is painful, but you like what's happening because you feel the knot relaxing, but it's painful. That would be a good pain. Right? It's like, yeah, it doesn't feel great. I'm uncomfortable, but the brain knows it's not non-threatening. So even though you're feeling pain, you know not to get upset about it and you know not to pull away because you feel it is being beneficial. What's happening is beneficial, like exercise.
And not to jump too far ahead on too many questions, but can you trick your brain to almost, because
yes,
to think that this is good for me?
Yes, you can. I am notorious for pushing too hard and actually like injuring myself while exercising. I have a few other, chronic conditions that let that happen more easily than other people. But that being said, and this is common, especially with my athletic population, if they get injured, I usually have to pull them back a little bit because they usually go, full tilt and then, delay their recovery or set themselves back because they're pushing too hard. So you can learn that, I can ignore this, right? This hurts a lot. I can ignore it, and then I'll push further and further because this is good for me, right? So the age-old saying, no pain, no gain. So the way I say that to people, muscle burn is good, but if you're having pain at your joint line while you're exercising, that's probably not good. You shouldn't push through that, right? And too much muscle burn is not great either, because then you get a fun little thing called rhabdomyolysis. So you have to pay attention to that as well. Too much of anything is too much. Yeah.
When I did an episode with someone I respect very much, John Guerriero, but one of the enlightenments I took away from that was mild discomfort.
Yes.
That it seems like discomfort is a good thing.
Yes.
But when it's mild.
Yes. Agreed.
Yeah.
What I tell people in the clinic when they ask about exercising in pain, you've got people who are pain avoidant. So on that 0 to 10 scale, which none of us really like, the number scale, some people hit a 1 or a 2, they're like, I need to stop right now. And that's not good, right? It's okay if you're 1 or a 2. That's the mild discomfort. We tell people it's okay to go to a 4 out of 10 level while moving, while exercising. When it hits a 5, you definitely want to then stop. You don't want it to be severe. When pain levels become severe, it takes longer for them to come down, and you might actually be risking injury.
So back to the piece about the different types of pain.
Yes.
So far we have the 2 categories of kind of like good and bad.
Right.
Can we also divide it to acute and chronic?
I would put everything
what
under
would you-
one umbrella as pain,
Yeah.
right? Now, even so, our perception of it being good or bad is what makes it good or bad,
Right.
right? So, in medicine, we use acute, subacute, and chronic, and their time frames. That's what decides what the pain is, right? Whether it's acute. Acute pain, if you like stub your toe on the coffee table, that's everybody's favorite analogy. Stubbing your toe on the coffee table, it hurts really bad. Hurts for, maybe a few seconds, and then eventually will go away if you didn't really crack it good. That's acute pain. So acute pain can last up to 3 months. So if you think about if you've had a surgery, that's acute pain. Most people are going to have pain after surgery. That's the 3-month mark. 3 to 6 months, we have pain. We call that subacute pain. That's a subacute stage. If it lasts more than 6 months, that's when it enters chronic, and that's when we see, patients who have a harder time bringing that pain level down. And I'll talk about that more in a minute.
Yeah.
Yeah.
So there's clearly this piece about perspective in this realm of how do you view this, and it almost seems to me like there's it's sometimes within your control and kind of also without your control, that perspective. I wonder how much control do we have over that perception piece? Because it almost seems like the body has to be convinced even outside of, for example, the autonomic nervous system just happens automatically.
Yes.
It seems like there are some things that are automatic without your conscious thought. And can you reprogram almost down to this deep bodily autonomic way that this is not a big deal, or
yes.
Tell
Yes,
me
you can.
more about that.
Yes, you can. I'm also a long-term meditator. I was a practicing Zen Buddhist for about 4 years. I wouldn't label myself anything right now, but I still do breathing exercises daily. I've practiced, martial arts that also are meditative, Tai Chi, Qigong, things like that. I've always been drawn to that side of things. One of the things we do in Zen is if while you're sitting and you're meditating, if you have a pain, they say bring your attention to the brain, bring your breath to the pain. So by bringing your breath, really what they're saying is bring your attention to it. Don't ignore it and see what happens. So having that curious mindset of I wonder what's going to happen. I wonder what this is. Oh, it's just pain. So having that mindset of this is just pain doesn't necessarily mean something's wrong, that something's bad is going to happen. And that's where people run into trouble if they catastrophize. So catastrophize is, this is the worst thing I have ever experienced. My life is over, right? That leads you down the bad path, right? Those perceptions, those irrational thoughts usually will limit, we call them fear avoidance beliefs, usually will limit your movement, limit your activity. You get weaker, you get tighter. That runs you down that we call a vicious cycle. So you're going to get more pain because now you're weaker, now you're tighter, now you're not moving well. Tissues actually degrade if we don't move. So cartilage actually degrades if we don't load it. So we're supposed to be loading our cartilage daily. And that starts pretty quick. I think that's within 72 hours. Within 72 hours of not moving, we start, our VO2 max decreases, our ejection fraction in our heart decreases. Our muscle mass starts to, we start atrophying. And this is 72 hours of bed rest, right? The only thing you're getting up to go do is go use the bathroom.
Right.
So bed rest overall is not good. So we've come a long way. Someone hurt their back way back when, 50 years ago, we told them, oh, bed rest. Now we're like, no, do not bed rest. Move as much as you can within the limits of your pain is what we usually say.
I'm going to get back to that one in a second.
Sure.
And I wanted to touch on one before I lost it, just while we were talking about defining pain. But there was a question I had that was, is there injury without pain and pain without injury?
Yes.
So meaning it comes back to, I guess, reinforcing that point of your perspective and your thought of it, but does that exist?
Yes, you can have pain without tissue damage, So the tissue damage, the Cartesian model is, I stub my toe, the sensory nerves, some people call them the pain fibers. There is no pain fibers. We have nociceptors, which are danger signals. So the danger signal goes up to your spinal cord. At the spinal cord, there's nerves called interneurons. They're the bouncers. They say whether you get to go up to the brain or not, right? So if the stimuli is not enough to even go to the brain, interneurons say, nope, you're not going anywhere. This wasn't a problem. But if it is, it goes up to the brain, then hits the thalamus. Thalamus then decides, oh, you can go to the cortex because this is important. But if it's not important at the cortex, that's the second group of bouncers. Say, nope, that's not important either. So pops up, and then you have the experience of pain. The brain, pain is an output. If you touch a hot stove, you're actually pulling your hand away before you sense the pain. Because the spinal cord said, danger, Will Robinson, danger. It makes you pull your hand back. And then you're like, ow! Like if you pay attention next time that happens, you'll pull your hand back before you actually say ow.
Right.
Yeah.
So are there two different systems at play? It sounds like almost like there's a system just for interpreting pain and a whole system for actual injury, if that makes sense.
It's all the same.
It is the same.
It is.
Okay.
It's all on their same thing because there's factors are so many. It varies literally moment to moment, day by day.
So how would I have pain without injury?
There's something called ectopic discharge. So you don't need antibiotics for it. What happens is the nociceptor will fire for no reason at all. And then your brain picks up the signal like, oh, that really hurt. That can be, we've all had these experiences where we'll just be moving. Something will hurt terribly and then not hurt again. That is possible that is ectopic discharge, right? That your brain perceived a threat for whatever reason, made you feel pain, even though there's no tissue damage. I've had that, certainly. I've had strange things that, oh, wow, that really hurt. Like, why'd that hurt? And then it never happens again. I don't know if you've had that, but I certainly have.
Yeah, I've had things in that realm for sure. And so then what about the idea of injury without pain? How does that happen?
Well, there are people born without nociceptors. So they're not feeling any pain. Spinal cord injury, right? If you get a spinal cord injury and you lose sensation, let's just say your lower half, and they have no nociception happening, you can cut them with a knife and bleed, and they won't feel it.
Wow.
So it's obvious tissue damage, but they can't feel it.
Wow.
Right? Because that pathway is now interrupted.
And that pathway is called, you said?
It's the nociceptors, danger signals.
That makes me think of the movie. There's one with Adam Sandler, I think Mr. Deeds. I don't know if you've ever seen it, but
it's been a while, but yeah.
There's a scene where he jokingly, it's all comedy, but he says, "Oh, I have no pain." I guess that he has that thing, but he says, "Oh, stick the knife in my foot or something." And he does it. He starts screaming. He makes believe, but it's a funny scene. But it always makes me think of the idea that you can have somebody who actually is getting an injury and don't feel it, but that can be a bad thing, which then goes to the benefit of pain, because you could be walking down a dark road and you don't even know that you're getting yourself hurt. Right.
If you have, not to interrupt you, if you have no nociceptors, right? Let's say you're one of these people that are born without nociception, and you put your hand on a hot stove, you're not paying attention, you just put your hand in a hot plate that you were just cooking with, a hot pan, and now you've burned your hand to a crisp. Now you've lost function. Now you have a hand you can't use.
So can some people have a heightened receptor?
Yes.
Where they're feeling more than the average?
That happens actually more in the brain than it does in the periphery. Right? So there are people who will send danger signals before it's true, what we call a noxious stimuli, which means actually damaging. Noxious stimuli is actually damaging. So they become hypersensitive to pain. So a light touch will cause them pain, even though it's not enough to cause tissue damage. So that happens. And then there's a circuit, they just found it. They just published it in Medscape. They found a circuit in the brain on some people that connects directly to their limbic system, where, and I may be misquoting this, so we can look it up later, where those people have a heightened perception of pain. So there are people who are more sensitive to pain just physiologically, but then you have cultural overlay with that. Certain cultures will express pain more than other cultures, right? And we've actually studied that too. Yeah. So more cultures, there's certain cultures are more stoic. If you think like Russians and the Japanese, they're less likely to complain about pain culturally. Latin people are more likely to complain about pain culturally.
So interesting.
Yeah, Italian people, Hispanic people
complain more.
Will complain more about quicker.
Right.
They'll feel the same pain as someone else.
Right.
But they'll let you know sooner. Because culturally they are more expressive.
And do you think that also then reinforces the pattern of actually feeling more pain?
It can.
Because it's now okay?
It can.
Right.
Yeah.
Yeah.
You know how when you see a medical practitioner and they ask you about your pain and ask you to rate it, it's actually the wrong thing that we're doing. So we're actually cueing people into their pain. We've done studies on this. It can actually promote chronic pain by making them think too much about their pain. Before we were required, I've been doing this long enough that before we were required to do this, we would just be like, how's your discomfort? What's going on today? You know, how are you feeling? And then they can tell us what's going on. But now we say, what is your pain level? Is it mild, moderate, or severe? And that can create more pain, but we're required to do it by governing agencies, so we do it.
So in the event where maybe someone does want to control their pain a little more because maybe they're experiencing too much, are there things that they can do
Yes.
to help with that?
Yep, there's a whole laundry list. Good lifestyle, number one. Getting enough aerobic exercise every single day. Aerobic exercise could just be walking around your home, you know, walking up and down stairs. It doesn't have to be this, you don't have to go to a gym to get aerobic exercise. You could do sit-to-stands out of your chair for a few times. There's a lot, just park further the next time you go to the grocery store. That's all aerobic exercise, but you need about 20 to 30 minutes, 5 days a week. That has been shown to help with pain through multiple mechanisms. Doing good sleep hygiene, making sure you're getting 7 to 8 hours of sleep per day. We heal in our sleep, so we'll get better healing for sleeping enough to get that healing. Getting the right treatment, that's really big. Making sure you have good practitioners. Making sure you're following your practitioner's recommendations. They tell you to take a certain medication, and it doesn't really work great for you, then communicate that with the practitioner rather than just stopping. Because I see that a lot. They'll just stop, or I don't like medicine, I'm not going to do that. I'm going to use herb XYZ, which we know 80% of supplements on the market don't have what they say they have in it. And some have dangerous things in it. So, yeah, you have to get good treatment off the bat, bring their pain level down when it's acute so that you don't develop chronic pain. Way easier to prevent chronic pain than to treat chronic pain. Yeah.
And you mentioned before mindfulness. So
yes.
that's one
that's
of those
on the
that
list.
Yeah,
mindfulness.
Thinking about the extreme end, you mentioned the piece about Japanese culture, and I know there's definitely like the samurai or you know, in the dojo, there's this ability to almost like push through pain.
100%.
And how does someone get there, whether that's necessarily good or not? Because again, we know there is value behind pain. It's telling you something. But how can someone get to a level that they can control themselves so much that,
There's a lot. There's a lot that we can unpack with that. So when we spar in the dojo, it's simulated combat. We knowingly are putting ourselves at risk. You know, we wear as much protective equipment as we can, but I've had my nose broken twice from sparring. I didn't feel pain when it happened. My head snapped back. I'm ready to go. And that, I was already a black belt by the time. I was already in the arts for a number of years. By repeated exposure, I'm blanking on the word right now, graded exposure. So by graded exposure, we can actually reduce the threat level, so that increases pain threshold.
Say that one more time, sorry.
Graded exposure. So by us sparring more, and you punching me in the face more, first time you get punched in the face, first time ever, you think your life is over. Right? You're like, oh my God, this is the worst thing ever. Right? That really hurt. You were young enough, you probably cried because you were a kid.
For sure.
You know? And then your dad probably came over and been like, it's fine.
Right.
You had positive reinforcement by an adult, an authority figure, say, hey, this is fine. This is actually okay. And then you're like, I am okay. I'm not dying, right? So by having those repeated experiences, you reinforce that brain map. We make brain maps of every experience that we have, the group of neurons that we fire that tell us about that experience. We know when we spar, there's a chance we can get hurt. We're probably not going to be seriously injured. So you're more willing to like put yourself at risk. And your brain is now pumping out hormones that help relieve the pain. You've got natural opiates in your brain. I forget in our bodies if they're called opioids or opiates. There is a difference. If it's outside of us, it's an opioid or opiate, but if it's inside of us, it's an opioid or opiate.
Gotcha.
And the reason any of those work is we already make it in our body. We have receptors for them in our body.
Right.
So any drug only works because we're making it ourselves too. Maybe not that compound, but something similar.
Right.
So we have what's called the wet brain. As soon as we get injured, as soon as we have pain, it fires all those things. It spreads those hormones out and actually starts to reduce your pain right away. There's different factors, right? Like if my arm were broken and then I see a bone sticking out of my arm, that's going to create a pretty big fear response. Like I know what that means. I'm like, oh my God, I'm going to get infected. You know what I mean?
Right.
That's going to hurt more.
Right.
It's going to hurt more because the injury was higher as well.
Right.
Your brain is the CEO. It decides how big the threat was. The bigger the threat, the more the pain.
And someone might then, when they hear that, they say, oh, so if your brain's a CEO and you have control over your brain, then that means that you should be able to just fix this in an instant. But I don't think that's necessarily true.
Right. That's the conscious mind.
Right.
And then you got a fun thing called the subconscious.
Right.
Which is all the experiences ever in your life that you've ever had. And that really runs the show. Your subconscious mind is what's really running the show. So some people have medical trauma. They went to a practitioner when they were kids, had a negative experience for whatever reason. And then they bring that forward into their adulthood and they may react and not even know why. Because the brain map gets activated. Your brain creates what's called a neural tag. The neural tag says, hey, this is that thing we don't like, right? Fire the brain map. Brain map fires. And then you have an N experience because every experience gets a map.
I love the word that you use, the subconscious brain. So it's not something that you can necessarily just think your way out of in an instant. This is something that it is involving your brain, but it has to be reinforced probably over time and built subconsciously into it.
Yeah. When you see, I don't know if you're familiar with Rage Against the Machine.
Oh, of course.
You know their
it's my favorite workout.
You know their first album?
Yes, but I'm not going to know exactly probably which songs.
No, not songs. So on the album cover, there's a Vietnamese monk.
Okay, yeah.
Self-immolating. He poured gasoline on himself, dropped a match. And if you zoom in on his face, the man is serene. How's that happening? Right? That takes years of practice to get to like that level. You know, he has reinforced through his reading, through his teaching, through his meditative practice. In his view, the body is a shell, right? So when the body goes, it's fine. He continues on. That's their belief. You have karma, you've got reincarnation, you have all that. So that can override a lot of the other signals.
So you believe that is actually possible to some degree?
If you sit and meditate for 30 years and train, yeah.
Right.
You could do that. But most of us can't.
Yeah. Especially in America. Right. I got to pull my cell phone out. Hold on.
Right, exactly. you know
10 seconds.
You ask your AI what the thing is, right?
Right.
Yeah.
But
so it is possible. Yeah. And we've people under hypnosis have been able to take stimuli that's noxious, that it's a highly suggestible state, hypnosis. So they've had people like put pins through their hands and not experience pain because they were told you won't experience pain. But that's not in like an everyday state. Right.
Yeah. So it sounds very much like your mind is involved in this process of how you're perceiving the pain. But it's very subconscious and probably based on so many past experiences in your life that even this one little, you can't just shift it that fast overnight. It now has to be reinforced again over time of shifting this perspective of how I view this and what it is.
Right.
Wow. Yeah. So moving into the piece, the other thing you mentioned before was about movement.
Yes.
And my podcast is Movement and Performance, but I always promote the benefits of movement.
Yes.
And it made me think of another thing, John Rady, that he pops into my head a lot, but and actually this stems from, I think, Teddy Roosevelt, who also said it, but the word of wear out versus rust out.
Yeah, I love that concept.
Yeah.
I heard that on your podcast, and I'm like, amen.
Yeah.
As soon as I heard it.
Yeah. So it sounds like it's funny how I love when many different perspectives lead back to that same principle, but so it sounds like this is leading to that principle as well. Do you think that if someone feels pain, they should still move? Or how much or little should they?
Yes.
Yeah.
The short answer is yes. I'll share an experience I had just last week. I had stretched my piriformis.
Right.
I had done it in a sitting position, and not thinking, I actually overstretched my quadratus lumborum, a back muscle. So I had back pain the next day.
Right.
Like by Friday, the next morning, the next afternoon, I was like, oh, this isn't good.
Right.
I was like in a 4 to 5 out of 10 pain level, just below severe. I was like, oh, I've got to, really take care of it. I took some ibuprofen. I was icing. I took out a tennis ball and started gently massaging it. Just touching those edges of pain. We call it nudging, and I'll come back to that. Remind me to come back to nudging. So I was doing all of these things to help reduce my pain level, help the tissues to heal as quick as possible, and reduce my threat level in my brain. So the next day I woke up, we were supposed to go hiking, took another dosage of ibuprofen, continued icing. I iced about twice a day, and I went for a hike. And so I'm on my hike. I'm like, I'm maybe a 4 out of 10. I'm right at the level where I tell most people don't go above it. By the middle of the hike, it was gone. Pain was gone. And then by the end of the hike, again, no pain. I sat in the car. Pain went to like a 1 or 2, maybe. I decided to do one more thing, ibuprofen, when I got home. I iced some more. But the next day, my pain was gone. So by Sunday, I was pain-free. Monday morning, I'm back to doing RDLs, and back to doing resistance training. So if I didn't do those things and I let my pain linger, I'm now reducing my functional capacity, which has multiple effects, right? I'm not giving myself the opportunity to challenge my cardiovascular system. I'm in my 50s now, so I want to preserve my muscle mass as long as I can. So I still resistance train twice a week, plus teach judo twice a week, plus do zone cardio twice a week, and I walk on my lunch hour for like 20 minutes. So yes. Yeah. So I really like try to embody that myself, right? Here I am teaching. I'm a physical therapist. I'm teaching motion is lotion. That's what we say. Motion is lotion. So moving in pain to the limit of pain is a good thing to do, right? If you hit that 4, you hit that 5, that's okay. You're not going to fall apart, right? So move into that pain a little bit. So nudging. Well, let's say like I hurt my triceps, right? So when I bend my elbow, I'm stretching my triceps. Now I hit that 4 to 10 there. I come off, I come back, I nudge just a little more. I get to the 5. I come off, I come back. Like, oh, look, I can go a little bit further. Oh, now it's a 5. I come off, I come back. So that's basically what you want to do with all exercise. You manipulate exercise in many, many ways. You've got volume, you've got load, you've got intensity, right? So all that comes into place, even with that. So, is 3 reps good? It might be. 20 reps might be good. It depends on the situation.
Is the idea of staying moving also maybe helping to distract you? That you're not sitting in the thought of pain?
Yeah, there's definitely an element of that, right? You're not locking and ruminating. Ruminating is a good word.
And social factors?
Oh, 100%.
I feel like if you're around people you love, you immediately threat goes down.
Yeah, all that, and you've got bonding chemicals that get released, oxytocin. Right, oxytocin's a bonding chemical. That's a mother's release when they breastfeed. We get the same thing when we do judo, when we do jujitsu. The pressure that we give each other on judo and jujitsu, with people that we feel safe with, will release oxytocin. That's a bonding chemical, which is why when you come off the mats, you feel amazing.
Right.
Like you're like, God, I love this. I love how I feel.
So when you say the pressure, you mean the pressure of touch?
Yeah.
Yeah.
Yeah. Axial pressure, deep pressure through your body. Some people get it through squatting with their buddies, workout partner. They load up weight in their back, they squat, they seek that feeling. You get the endorphin rush, right? The runner's high.
Yeah.
Those are all real.
Yeah.
And when you add the layer of a social element, people that you love, people that you trust, everything gets elevated. Threat is reduced, just like you said. So when threat is reduced, pain threshold, the amount of stimulus it takes to make you feel pain goes up. Right? So that's what we're looking to do. We're always looking to bring the pain threshold up.
The other one I wanted to touch on, and you said that you did it in there, was ice. I feel like I hear mixed things nowadays about ice, and I'm curious your opinion. Will it help an injury? Should we not let it happen? I think some people have hinted at the fact that, the inflammation process is a good thing and you should let it flow. But what are your thoughts?
It's a nuanced answer.
Yeah.
And I think when people take a black and white approach to that, I think it's wrong.
Right.
Because it's going to be contextual. Right? When do you add ice? When do you not? Sometimes I use heat. Right? It depends on when you use the modality of choice. Heat doesn't penetrate very far unless you sit in a hot tub, right? Or sit in a sauna. That's going to bring core temperature up.
Right.
But a hot pack you put on yourself, it's going to make you feel good. And there's nothing wrong with that.
Right.
That reduces threat, right?
Right.
So that in and of itself is beneficial. I have people do it at home rather than do it in the clinic. I'm like, it's better to have my expertise, have my hands on you doing manual therapy, having my expertise with exercises. I don't have magic heat in my clinic. I also don't have magic ice in my clinic. So I don't usually use a lot of ice and heat inside the clinic, but I often recommend it at home. So ice with compression has been shown to relieve some inflammation. Some inflammation is good. It does promote healing. It brings in healing factors, brings in platelets. Platelets have growth factor within it. So it promotes like PRP, platelet-rich plasma. That promotes healing by those factors, those healing factors. I use a tool in my massage. I don't say this, but it's pro-inflammatory. I don't say those words because I don't want to freak people out.
Right.
What I say is I want to bring blood flow to the area. So by bringing in blood flow, the inflammation, you're bringing in healing factors. That's usually a good thing. But too much of anything is bad. Too much water kills you, right? Too much inflammation limits your function, increases your pain, increases your threat level, so now you're not going to want to move as much. So reducing the inflammation to a point where you can still live and function and exercise, that's a good thing.
Yeah, so it's nuance. It's a push and pull. There's times when you may want to, and there's times when you may not.
Yep.
So if a kid, and that makes sense to me, because if you're, it depends what you need in that moment.
Right.
Are you too inflamed or are you not inflamed enough?
Right.
Do we need to create flow or do we need to reduce flow?
Right.
So that makes sense to me. So I guess this would still be a nuanced answer, but a kid gets kicked in the dojo and his shin is ringing of pain. Would you give him ice or?
You see how you rubbed your shin?
Yeah.
We all do that, right?
Yeah.
So that rubbing is called gating. So you've heard the gate theory of pain, maybe
I
not.
don't think so, actually.
So the gate theory, people use Bengay.
Yes.
So that makes the skin tingle. The pain didn't actually stop. And Bengay does nothing to promote your healing. All it does is irritate the skin. So what that does, you've got 3 afferent fibers, sensory fibers, that run to the spinal cord. You've got the A alpha, the A beta, and the C fiber. C fiber is unmyelinated. So think of a wire without any insulation. Doesn't transmit electricity as well. The A fibers have myelin, they have insulation, they run faster. Light touch is what the A alphas and betas send. Light touch, a little bit of pressure. So by rubbing it, you start relieving your pain. We all know this intuitively. Yeah, give the kid ice.
Yeah.
So numb the skin out.
Yeah.
So you numb the skin out, and then you're like, it gives that time for the brain to do its thing. It's like, yeah, that feels better.
Yeah, because if you're numb, you're feeling less pain.
Yeah. And you're not, ice isn't penetrate so far that you're reducing inflammation so much
Right. What are you going to have it on? 5 minutes?
Right.
Like,
Yeah.
you're still going to be inflamed later.
Right. Don't worry.
Right. It's probably good for that extreme moment in the beginning, like you said,
Yes.
because, and there's probably many factors, because also now the kid thinks this is healing me to some degree. There's
Exactly.
in that like peak, I used to tell kids like, splash a little water on your face. Trust me, it makes you feel great. Like,
yeah.
And there's even science to that too, like minimizing, I think, blood pressure or something with like.
Cold water on the face?
Cool water on the face, yeah. But like, if you just tell someone sit there and eat it, like they're gonna feel more miserable. If you tell them like I'm giving you something, yeah.
Yeah.
So it seems like because inflammation is still gonna happen. That 5 minutes of ice is not gonna.
No. It's not gonna stop inflammation.
Right.
Right. And the placebo effect.
Right.
Placebo effect is huge.
Yeah.
Right. It is active in 30% of every modality we do, whether the thing works or not. So we can leverage placebo to help reduce pain. Just saying to someone, "Oh, you're gonna love this. It's gonna be great." Just saying that, they're like, "Oh, wow, that's." Then making that anticipation, making that is good for them. That reduces their pain level. That reduces the threshold. Expectation is really big, right? So when you're getting a blood draw, or you get an injection, they're like, all right, you can feel a little pinch. They don't say, I'm stabbing you with this sharpened needle.
Right.
They don't say that.
Right.
Because we're all going to be like, get out of here with that.
Right.
Who's stabbing who with the needle?
Right.
So when we give someone an expectation, little pinch, and then they give it, sometimes it's not that little of a pinch.
Right.
I've had joint injections where, I've said words that rhyme with luck. And I'm like, that's really terrible. That hurt a whole lot.
Right.
And I've had the same injection to the same knee different times with different levels of pain. I can't explain why one day it hurts more. I've had an experience where it didn't hurt at all.
Right.
The needle went in and I'm like, barely feel that. Same knee, same doctor, same medicine.
So there's still nuances with pain.
100%.
We know a good amount, but like, yeah.
Yeah. The thing that stuck in my head when I was a kid, I'll tell two stories because I love analogies. Like your dad's the best at them. He's like the best at analogies. So one was we had a security guard at my first job. I worked at Westchester Medical Center. And he stood with his spine in a question mark shape. So his lumbar spine was like straight, but then his thoracic spine actually curved back to the point where his arms hung behind him when he stood up. So we're all like, God, that guy's got to be in a ton of pain. Like all of us. Like, man, how's he work? How's he live? So one day we're like, we just got to ask you, does your back hurt? And he's like, all you physical therapists want to know if my back hurts. No, my back does not hurt. So here was this guy with a position that all of us would look at and be like, that's bad. He's got to be hurting. Has no pain at all. Right? And then another thing, when I was a kid, I was 12. One of my teachers brought me home. She was my tutor, and she was tutoring my sister. So she brought me home. And I closed her car door, and I feel a tug on my hand. I'm like, that's weird. And then I feel some pressure in my hand. I'm like, that's weird. And then I look at my finger, and it's a bloody, mangled mess.
Oh, wow.
Yeah. And my nail is mostly popped off, and there's blood everywhere. And the pain hit me like a tidal wave. I remember seeing the damage and screaming. So I went from not having pain, having a sensation of pressure, to having intense pain instantly as soon as I saw it. And I was like,
Right.
That's what brought the pain on. And that stuck with me. I'm like, why? Like, why is that? So when I get hurt now, I get like really clinical, right? If there's anything I want people to take away from when they have a pain experience, is when you get hurt, don't freak out. Just assess it, have the appropriate amount of concern to get it treated correctly, but don't freak out, right?
And that could be probably easier said than done. But
Yes.
if you reinforce that over time,
Yes,
it has potential to work. It's not magic.
that's right. That's right. You need reps.
The first time you do it, you're going to say it's not a big deal, but you're going to be fighting it's a big deal. And that like subconscious and conscious are going to tug, little tug of war. And eventually it slowly gets better over time. So it's not saying like it's just going to be this magic thing that happens.
That'd be great.
Yeah, right, yeah. Although I'm sure there's some crazy stories out there of some like, almost magical moment, but it still probably stems back to that subconscious. It's like your mom showed up, I don't know.
Yeah, yeah. And there's pain is bizarre. There was an experience of a gentleman who, I believe he's in China. He was a construction worker, and he was using a nail gun. And the nail gun hit a knot, and he didn't know where it went. Couldn't find the nail. So he just went about his day. Right. 2 days later, he starts developing a headache. So he goes to the doctor, goes to the hospital. They do an x-ray of his head, and the nail is inside his nose, all the way up near his brain.
That's crazy.
And he didn't feel it at first. It took 2 days for him to get a headache before he could tell. So pain's bizarre. It does a lot of weird stuff. He didn't have a threat. He didn't know where the nail went. And it hit in such a way that he literally didn't feel it.
That's crazy.
Yeah.
So yeah, I think a lot of the pain we talked about was traumatic.
Yes.
Last thing just to touch on before we start to slowly wrap things up, but what about the idea of overuse pain? So I just asked that because a lot of people in fitness
Repetitive stress injuries
tend to get repetitive, whether it's like climbing or running or and it seems like it stems from overuse potentially or too much too soon, or any thoughts on that?
That's a great way to put it. We say that too much too soon too quick.
Yeah.
Right. That's what leads to overuse injuries. Tendinoses. We know nowadays that most tendinopathies, meaning injuries to the tendon, are overuse, and there's usually not an element of inflammation. Sometimes you have an acute tendinitis, right, where you have inflammation of the tendon. A lot of times you have tendinosis, which is damage to the tendon without swelling. They're treated slightly differently. Tendinitis, you want to start hitting with anti-inflammatories, bring that down, and you want to start moving and exercising. Tendinopathies with straight tendinosis, you only need the anti-inflammatories if there's an analgesic effect, a pain relieving effect. But we treat it with exercise. One of the best ways to get over these overuse injuries is strength training, and especially slow tempo strength training. That's what we know. That's the latest. Before there was just eccentrics that do a lot of eccentrics, right? Low load eccentrics. So now we're saying a slow concentric and a slow eccentric is also beneficial, doing both under the appropriate load.
And my assumption would be taking some form of a balanced approach. So for example, if your sport has a lot of rowing, maybe you need to make sure you get some pushing in your resistance training.
Yeah.
When people ask me, I teach a class called climbing conditioning, and they're like, the best way to get good at climbing is climbing. I say, of course, I completely agree. Couldn't agree more. But you can't climb every single day. So this is an opportunity to do something different. And one of the things we target is sometimes those muscles you're not using as much to help get that balanced approach so you don't get an injury. And you might not even realize this, how it's helping you in this, way, but it seems like taking a balanced approach to that resistance training is important.
Yeah, and you want to get assessed by a professional who understands the kinetic chain. Right. Like if you have an ankle injury, you need to look at the hip, right, and you need to look at the low back too. So you need to balance all, because most of the time you'll find if the ankle's weak and there's an injury of the ankle, you're going to find weakness in the hip. I've seen it almost every single time. So you need to, if a person's elbow hurts, I'm always finding something at the shoulder. Same thing with the wrist. There's always something at the shoulder. So you need to address the whole picture in order to get someone better, so they're not coming back to you over and over and over. And you can resolve the problem fully.
Right.
Yeah.
Yeah, that would make sense. Like your core, your torso, a lot of the problems on the outside will probably come back to something that's off there and just spiraling down to the end.
That's right, because it's people without realizing it will get into physical activities and do something that's good for them. They'll injure themselves because they don't have the base strength to be doing that thing. Their pelvis isn't level. Every time they run, their pelvis is dropping like that. And over time, that leads to problems. It's not going to happen. May not happen today. May not happen in a month. but most likely it's going to happen.
So resistance training will create this firmness or stiffness potentially, or I don't know what the word is I'm looking for, but
stabilization.
The stabilization.
Yeah.
That's like a prerequisite for most activities.
That's right. You need to move from a stable core most of the time. You need to have a mobile core, but it also has to be stable. Otherwise, you can't move effectively. You'll be predisposed to injuries because you're fatiguing out too much. And people who climb, they want to climb, but doing that class you have is excellent because you have to. I won't name names because I don't want people mad at me, but certain groups, they only want to do that activity.
Right.
Like there's a thing that they love and they only want to do that. It's not martial artists.
Right.
They don't want to.
You could call them out if you want.
It's really not us. We understand.
Yeah.
Most of us understand you got to do other things.
Yeah.
But
runners. No.
I didn't want to say that. I didn't want to say that, but yes.
Yeah.
You got to strength train.
Right.
But a lot of people, they want to do that thing that gives them that feeling that they're searching for.
Right.
Right. But you have to strength train so that you can continue that activity you love.
Right. And it also I think people can probably benefit from taking the approach of variety. I usually say, like, when you want to be an expert in one thing, you end up falling to an extreme. And anytime you go to the extremes, you can run into some issues. So the idea of not every activity do you have to be, you don't have to necessarily be a runner who runs the marathon. You could just run for the sake of enjoying that running, and then climb, and then kayak, and then martial arts, and I think variety is great for kind of like potentially some sort of pain management. Yeah,
as I've gotten older, I've realized I don't have to walk into the gym and do HIIT every single time.
Right.
Like it doesn't have to be high intensity
every
single time. But just moving is beneficial. Yeah, you get out there and move and start moving, and that will help with pain as well. Your pain levels go down, you feel good, you improve blood flow to the area. That's one of the reasons aerobic activity works well. You're increasing circulation through the whole body.
Which is going to bring good stuff and take bad stuff away.
Exactly, flush out all the stuff, and you promote healing.
Yeah. I think I covered the bulk of my questions.
You had one we didn't get to. You wanted?
It's a big one. Which one?
About the samurai, and how can people have an injury and not?
Yeah.
You kind of touched on it a little bit.
Yeah.
We talked about the wet brain.
Yeah.
So one of my favorite analogies, even at work, especially people who've served in the military and have been in combat, people have been shot and not known it. They got shot in a place where they continue functioning. And then later on, they have to check, and they're like, "Oh, you're bleeding."
Right.
And then they find out, oh, they had it through and through, through their abs, the abdominal muscles are through and through here, right in the pec, and missed everything major, but still it went through the muscles. They didn't feel it at the time because the brain, being the CEO, was like, "This wasn't a big deal. You can still function, and it's more important to keep you alive than it is to feel the pain." So you have to we use extreme examples because they illustrate the point really well. You have to stay alive. You have to keep the body safe. The brain's telling you, we're going to end if we don't pay attention to what's happening right now in a combat situation.
Yeah, it seems like combat would actually provide a little bit of, that's what I'm looking for, where you might not feel that pain as much. You'll probably feel it when you go home later.
100%.
But in that moment, it's going to provide an environment where there's other higher priorities that need to be maintained. So we don't need to focus on pain right now.
Right. Like people who are stuck in a burning car.
Right.
And they are actively being burned. They feel some pain, but they know they have to get out. So they fight like hell to get out of the car. They may break windows, whatever needs to happen, they get out of the car. Then they feel the pain later on. Because their brain's like, you have to get out. It doesn't matter if you're hurting.
While we're on, this is probably a little darker topic, but thinking about someone in the military who was like captured, or now they're being tortured.
Right.
In an event of like something crazy like that, are you able to disassociate even in that event?
I don't know. I don't honestly know. I know people have held out. I hear things like everyone cracks eventually.
Right.
You know, I've voluntarily waterboarded myself just to see what that was like. Man, I talk in 5 seconds.
Right.
I'm telling you right now.
Right.
I had a service member who is a friend of mine, special operations. He said about 10 seconds it took for him to be like, no.
Yeah.
Like, but that's in a controlled environment where you get to say no.
Right.
Like, you don't know what it would be like in that situation.
Right.
I'm sure some people do dissociate and put their conscious brain in a different place.
Right. Yeah, I don't want to end on a dark note now. We'll edit that in a different way.
Now, so my usual takeaways, one thing I didn't get to say that I really, really like is hurt does not always equal harm. I say that to my patients when we're doing an exercise, they had knee replacement, they're bending the knee, and it hurts a whole lot. We're talking severe pain. So they may have a little bit of severe pain, and it's okay. It's just the tissues letting you know they're not happy with what's happening. It doesn't mean something bad is happening. So we always want to bring that across, like hurt does not always equal harm. And motion is lotion. Those are the two ones we use a lot.
Right. I like that motion is lotion.
Yeah.
Like, in whatever pain you feel now, you're not necessarily stuck there.
100%.
You can absolutely shift your perspective on this and get out of it.
Even in chronic pain, we know that people with chronic pain, if they've had severe chronic pain for many, many years, their chances of being pain-free are near zero.
Right.
But we can bring it down to a 3, which
Right.
most of them will be like, God, yes, please do that.
Right.
And then there's specific treatment protocol to help them with that too.
And any words for anybody that, I guess, that individual that you said you think about at night, that maybe they, for some reason, they just like, you're trying so much and they just seem like they're always coming back, like I'm still in pain, or is there any advice or things that they can consider?
I usually tell people if they're stuck in the loop of, this really sucks, I hate what's happening, I can't do X, Y, and Z, I usually tell them to focus on what is improving. Focus on the parts of your life that are working. Focus on like what you're doing better. I've had people, I use this example all the time at work, someone comes in day 1, it's about a 5 out of 10 pain, John. I'm like, okay. Then they're up here. I'm like, well, how's it now? It's a 5 out of 10. It's the same, John. It's a 5 out of 10 pain level. And I'm like, but you can go higher. I know, John, but it still hurts. I'm like, I know, but now you can reach that cupboard, right? Now you can get the coffee mug out that you couldn't get out before. Like, oh, yeah. And so focusing on what's improving will actually help you overcome. The pain may be the last thing to go away. We don't always know. So continue with the exercises, continue on the journey, find other practitioners if the one you're with isn't giving you the answers that, are appropriate. And maybe not the answers you want to hear.
Right. There's always hope.
Always hope.
There's no one's ever stuck in the mud because, part of I don't know if I told you I'm writing a book.
Oh, no.
Which is cool.
Awesome.
But I just start with, a little piece actually about physics. And that when you look at physics or anything in the universe, every single thing moves. And
down to the subatomic level.
Everything down to the subatomic level. And even when you think the coldest thing that would have been ice and completely frozen, or when they start to look at like quantum physics, and there's always a potential for movement.
Right.
And so if there's potential for movement, it can always bounce back in another direction.
Right.
So there's always hope, and we just got to figure out, and play with different things until we get there.
Yeah, agreed.
I feel pretty good. Any last big things? I feel like we hit it all.
No, I think I said, if you get hurt, don't freak out. Hurt does not equal harm. Just assess properly, get the right treatment, get the right practitioners, follow those recommendations, and focus on what's getting better.
Yeah, I took a class back in the day on the science of happiness too, which is interesting. And it seems like happier people might experience less pain. I don't know, might go hand in hand.
Yeah.
So just the idea of like, what is the science of happiness? They say things like, and stuff we talked about today, being social, experiencing awe in places that are like beautiful and nice, gratitude, journal, positive self-talk. And it seems like all of those things are shifting that perspective a bit of how you're interpreting a situation And you could look at any situation in many different ways. Like you said, I could focus on the pain right now, or I could focus on the fact that, wow, I'm actually able to reach this thing. But it seems like the science of happiness has the potential to help with pain too.
Yeah, I agree.
Yeah. Thank you so much for today.
Thank you.
This was awesome. We finally made it happen.
Yeah.
All those after dojo chats in Mexican restaurants and a beer or whatever it is. And now
perfect.
we brought it to life. So thank you for today.
Thank you. Awesome.